Hey, good afternoon, Pittsburgh. This is Dr. John Metcalf, Medical Director at Medical Marijuana Specialist, and I want to thank you for the honor of being here today. I'm also here with my nurse Shelley and my office manager and patient advocate Kayla, and I've been asked to present a series of lectures to medical people, personnel, concerning cannabis and the various different aspects. I'm going to propose 4 different seminars. The first one will be the science and the history of medical marijuana. The second one will be on the endocannabinoid system. The third video will deal with specifically the process of how people get registered, certified for medical cannabis. And the fourth one will be dealing with a lot of the questions and issues that physicians have been writing in to me and asking me my response. Just a little bit of information about myself. I'm a board certified internist. I finished my residency here in Pittsburgh at St. Francis Medical Center, and I've been doing occupational medicine, emergency medicine. For the last couple of years I've been doing cannabis, and it's been a real honor and a privilege for me to do that. So today I'll start on the part 1 of the science and history of medical cannabis. Now, just to let you know, cannabis, according to documentations, has been around for at least 5,000 years. 3000 BC, we've had documentations from the Egyptians, from India, and from China, and the various different graves that the cannabis plant was actually there. So it's been used as a medicine for thousands of years. Now, to start the journey into the Western culture, in 1839, a surgeon from England by the name of William Shaughnessy went over to India to study, and he found about cannabis, how it was helping people with so many different problems. And he was very impressed with his experience with it, and so he brought it back to the West. Now, for the next 100 years, cannabis has been used mainline medicine, including in the American medical community. The AMA and various different pharmaceutical companies, including Bayer, were high proponents of that. In fact, the founder of modern medicine, William Osler, he recommended using cannabis as the best medicine he had for migraine headaches. Very impressive. Now, unfortunately, back in the 1930s and 40s, there was a social change here in America. And in 1940, cannabis was taken off the pharmacopoeia, which is a listing of the various different medications. Because of the different social changes, including, maybe you recall, a movie was made by Reefer Madness, that actually catapulted cannabis into a very strange position, and they made it a Schedule 1 shortly thereafter. Now, in 1952, cannabis was made a narcotic. And in 1970, THC, the more psychoactive component of cannabis, was actually made a Schedule 1, which is similar to LSD and heroin. It really had no particular value. Now, in December 16th of 2018, CBD, another component of cannabis, was also made a Schedule 1 drug, which has made it very difficult for research and for it to be used. Now, that stated, there's currently 33 states that have medical cannabis and 10 states that have recreational. There's a lot more research being forwarded, and Pennsylvania is leading the nation. I have to commend Secretary of Health, Dr. Rachel Levine, for all of her work that she's done, including getting 8 medical universities here in Pennsylvania to start doing research on cannabis. Now, I'll give you a little bit about the components of cannabis, is that there are 4 major categories. There's the phytocannabinoids. Phyto means plant-based. These mimic our own body's cannabinoids, which I'll talk about in part 2 of the endocannabinoid system. Now, some of these might be like CBD, which has been used for seizure disorders, anxiety, depression, cancer to some extent, and for nausea and vomiting. And another one probably most of you are aware of, especially for back in the 1960s and 70s, the THC, the more psychoactive component, which can get you high or stoned, and it can also be used for seizures, it can be used for sedation, it can be used for appetite stimulation. So there's a lot of different things, and there's probably over 100 different phytocannabinoids. The second major group is terpenes. Terpenes are what give it flavor, aroma, and color. There's terpenes that are sedative, like myrcene, which is sometimes up to 40% of the cannabinoid terpene profile, and also linalool. Now, other terpenes that are more energetic are things such as limonene, as well as pinene and beta-caryophyllene. All of these compounds work synergistically with the phytocannabinoids. The third major group is what they call the antioxidants. Things such as canaflavin A, B, and C, which are unique to the cannabis plant itself. Also apigenin and quercetin. And basically what antioxidants do is they protect us against free radical damage from cells and electrons that are released during the oxidative process. The fourth group, which is not much is known about, is cannabis alkaloids. These are nitrogen compounds that actually work physiologically in the body. Now, what makes cannabis so unique as a medicine and an herbal product is the fact is it has what they call an entourage effect. What that basically means, all of these different compounds work together synergistically to try to bring the body back into balance. Versus, let's say, a drug that has one molecule, typically, that has one effect on the body that creates side effects both upstream and downstream. So this really makes cannabis unique profile. And as you're probably well aware of, there's the main strains such as indica, which is more like THC, or sativa, which is more CBD, and there's hybrids. There's probably over 6,000 different strains based upon the last research that I did. And these compounds have over 700 different compounds in cannabis, of course, based upon an article in 2005. Ethan Russo, which is an international researcher and neurologist, felt that classifying cannabis as indica, sativa, or hybrid probably is old school, and he's looking more towards the amount of milligrams that the actual compound has within the product that you might buy at a dispensary. Anyway, this kind of wraps up basically the science and the history of cannabis in a nutshell, and I greatly appreciate your taking the time to review this. Again, be well and know that we care. You have a great day, and thanks again for dropping by. Dr. John Metcalf from Medical Marijuana Specialists.